Hi guys, this is Edna coming back to you again. It's been a minute since we recorded the last video. And today, honestly, we're going to kind of deal with a little bit or talk about a few health issues out there. I was privileged in the last couple weeks to visit Kenya, and it was due to some really difficult circumstances. My dad passed away, and just by visiting Kenya, I was inspired to come back and talk about a few issues dealing with health, because I felt like we are all affected, either it's personally, in families, countrywide, worldwide, we have health issues. So we will start today by talking about women health. And in the next video, I'll talk about men's health, and then we'll go disease processes one by one. And we are going to really focus mainly on how do we keep ourselves healthy, how do we screen ourselves to really be able to capture these disease processes before they get too advanced and become untreatable, because it's some of the issues we deal with our health can be prevented. Of course, there are things like cancer, there are things like accidents that we can't prevent, but if we can be able to prevent a lot of issues, I think it's important for us to kind of have the knowledge base on how to do that. So today I'm going to mainly focus about women health, and I'm going to discuss some of the we'll talk about 5 to 6 major issues that affect women health. And that is a topic of passion for me, because of course I'm a woman. I have 2 girls, and in general, it's just women health has been one of those things that have been special to my heart. So we're going to down the line, and I'm going to talk on really general, some of the major issues that women deal with worldwide, how we can try to prevent ourselves from these medical issues. And then after that, we're going to discuss about men's health. So World Health Organization rates cancer as the leading cause of death for women. And with cancer, I'm going to kind of divide it into 2 major type of cancers that are leading causes of women health. Breast cancer is a major one, and then cervical cancer or uterine cancer is the second largest. And for breast cancer, unfortunately, most of the breast cancers have genetic predisposition to it. There's specific group of genetic marker that is passed along generation after generation that actually causes breast cancer. So how do we prevent something that we really cannot prevent from getting? My grandmother had breast cancer, my mother had breast cancer, and then now I, maybe a 20 some year old female, I'm worried about, will I eventually get breast cancer? Because if it's in your family, you've been past that genetic predisposition of getting breast cancer. So the most important thing you need to know as a young woman is to be screened for breast cancer. So if your mother, your grandmother, aunties had breast cancer, it's important to screen for breast cancer early on in your life. You cannot wait until you're 60 years old for that cancer to grow in your body to start doing something about it. You can actually screen breast cancer at a very early age. So look at the time your first relative passed away. So if they passed away at 40 years old with breast cancer, chances are you need to start screening for breast cancer at least 10 to 20 years prior to that. So in your 20s, you need to go for mammogram. You need to do self-breast examination on a daily basis. On a daily basis, when you're showering, weekly basis. Just that's a self-care thing that you need to do for yourself. So when you're in the shower, you take the palm of your arms, make it really, really soapy, and then you go around your breast, starting from the nipple going outwards. You can Google how to do self-breast exam, and usually it helps when you do it in a wet surface, because it's a sliding motion, and usually you can feel like grains, which is normal. And if it's like a solid mass that is not movable, that is something to go see your doctor about, so that they can see if it's actually something they need to worry about. Sometimes they might do biopsy, sometimes they might do mammogram, just to see if it's actually cancer or just some abnormal tissues around it. So screening is important. Do self check, do your mammograms early on before the age your actual relative was diagnosed with breast cancer. So we're going to move on to the second one. And after that, once you do a mammogram, even if it's negative, do an yearly mammogram after that. Right now in the US, it's recommended from age 40. If you have history of breast cancer, you might start that at 25, you might start at 30, but do an yearly mammogram just to follow up so that in case some type of cancer pops up at, between that 1 year, you're able to do something about it before it becomes stage 2, stage 3, stage 4 cancer that you can't do anything about it. So usually if it's a very small, tiny cancer starting to form, they can remove what they call lobectomy, where they can just remove the part of the breast that has the cancerous cells if it hasn't spread. Some people that I've seen some people that have really bad genetic predisposition to breast cancer actually do what they call preventative measures, where they actually remove their breast tissues and just put artificial a breast in there. They can use your body tissues to implant into the breast area, or they can do some, they can use silicone, other artificial stuff to implant breast. But that's up to you. It depends on how aggressive cancer is in your family. It depends on how aggressive, you want to be about preventing yourself from getting breast cancer. We're going to move on to cervical cancer. Cervical cancer is a major one for women because usually it doesn't have a lot of symptoms. And when the symptoms come, it's later on in the processes. So there's one particular STD that is highly linked to cervical cancer, HPV. HPV right now in the last few years, they've actually introduced Varigard, which is a vaccination against HPV. Unfortunately, over 80% of people carry HPV with no symptoms. Some people will shed HPV out of their system over the years because of your system is going to kind of fight whatever virus is in your body. It's a virus. So usually you don't see symptoms. You might fight it. It might not produce any symptoms, but there are a few percentage of people that it converts into cancer. So how do you prevent this? You need to do what they call pap smears every year, where they go and scrape the cervical wall and test for any HPV viruses in there, and then they can be able to discern which type of HPV do you have, because there's various types of HPVs. There's one that causes cancer, the one that causes genital warts. Actually, people get afraid of the one that causes genital warts, but that is just more cosmetic because you actually see the warts, but it doesn't necessarily 100% convert to cancer. The one that you cannot see is actually the one that causes cancer. So it's very important for you to know that part. Do yearly as a female. Once you reach that age of being sexually active, it's important to do a pap smear every year. See your doctor every year and do a pap smear, period. That is the only way to prevent you from getting breast cancer, and they can be able to pick up HPV early on in the stage. All right, we'll move on. We've kind of dwelt on cancer because that's a big one. I feel like that is a major one across the world that affects women. The reproductive health, we will talk about reproductive health because it's classified as the second most. It affects about 1/3 of the women population between the age of they put it 18 to about 59. I think that is very individual, and you need to talk to your doctors about reproductive health. So I will leave that there just because I feel like there's nothing particularly we can do to prevent that other than avoid abortion. If you have to have an abortion, go see a doctor to do a proper abortion. I don't advocate for abortion, but if you have to do it, please don't go to the village and get some medication for some quack to give you to get rid of that child. Go seek medical care for that. It's an issue in the US right now because actually abortion has been illegalized in the US. So I think we probably will be seeing a lot of illegal abortions over the course of the year due to that factor. In Kenya or in third world countries, I know that is one of the things that, you get the women in the village doing abortions randomly. If you do multiple abortions, it's going to affect your reproductive health. Later on in life, when you want children, you can't have children because you pretty much have messed up your uterus. So just keep that in mind. HPV is an STD we've talked about. Major issues with women is STDs too. It's actually shown that the increased population between age 20 to 52 years old of young female are affected with HIV. So HIV is one of the most rampant, I think, virus that is affecting young women now. It's the leading cause of death in low-income population of women. And this, we're talking about third world countries, because most of the time we are vulnerable. Women get taken advantage of. We use our bodies to seek, you just you find yourself in situations where you're exposed to HIV without even knowing. And it's going to take a while before you see the symptoms. By the time you see the symptoms, it's kind of advanced. So just keep that in mind. Prevent yourself, please. Use condoms if you have to have sex, period. There's no way around that. And I normally say, if you're not married yet and you're starting new relationships, and this is, I think everybody should actually do this to actually try to reduce the number of HIV/AIDS that is being spread amongst young women. If you're single, you're starting a new relationship, utilize using condoms for at least the first few months. During those first few months, initially when you meet with your partner, just so that you know ahead of time, you both need to go for STD HIV testing. After you do the testing on your initial early stages of a relationship, use condoms until you get another test. Usually I tell people 3 months into the relationship, you both go in and get tested, because chances are you meet a person, if you meet him today and this person was involved sexually with somebody else yesterday or a week before you met, and they contract HIV, if you do a testing a week later, you're not going to see the HIV virus, because it takes a while to incubate in your body. So the initial testing is important to see if there's anything that's already been kind of incubated. This person is actually negative or positive at that particular time. And then wait 3 months before you have unprotected sex to be able to do another testing to ensure that you and your partner are both HIV negative. That is the only way to prevent that. And of course, as you're going through the relationship, if you are, you suspect infidelity, it's important to get checked in order to talk to your partner about this, because this is your health you're talking about. Testing for STDs, very important initial stage of your relationship. And then 3 months later, after you've started the relationship, make sure you check for all STDs, including HIV. I think that's going to put you in a position where you're trying your best to prevent yourself, because God gave you this body to protect it. Okay, it's a vessel that you're given by God to make sure to protect it. So do whatever you can possibly as a human being to protect yourself. Because if you don't do that, if you're careless with life, chances are, there's just so many risk factors out there that we have to deal with as women. You haven't even dealt with having kids, being HIV positive and having children, all the STDs that are going to affect your reproductive system. We kind of talked about our reproductive system early on, but we'll dwell into reproductive system. That's another topic for another day. But getting all these STDs, screening ahead of time so you're not constantly exposing yourself to multiple partners with multiple infection is important to be able to prevent your reproductive system, to protect your health and protect your children. Until there, I'll make this a very short video. Next time, we will talk more about the different disease processes that affects women on a daily basis. I'm going to wish you all a wonderful day, and hopefully you learned something from this video. God bless you. Until next time, we will talk.